Overpopulation continues to be a pressing issue globally, deteriorating the health of our planet and impacting our own well-being. As per experts, the global population grows by more than 80 million people every year. Today, there are more than 7.8 billion people living on our planet, and the population is projected to exceed 9 billion by 2050. Our ever-increasing population is pushing the planet to the limit by depleting natural resources and generating too much waste, leaving behind widespread wastelands and polluted water bodies. Overpopulation is often an effect of high birth rates, low mortality rates due to medical advancements, lack of family planning consciousness and services, and the most pressing cause of all, a lack of education and awareness. Poverty and illiteracy have been the two major drivers of overpopulation in India. Impoverished families or families living below the poverty line often believe in the idea that the more family members they have, the greater their chances are of earning a better living. They tend to overlook education as a key to improved living standards. On-ground campaigns are instrumental in changing this mindset.
Community mobilization is very important to help young couples delay first pregnancy, for example. It's very important to let the couple get to know each other, to settle down with each other rather than just jump into having a baby when they're just about getting out of adolescence themselves.
To understand more about the state of overpopulation and family planning efforts in one of India's most populous states, we travel to Uttar Pradesh, where the Mobius Foundation is trying to make a difference. Project Akar is being implemented in districts with some of the highest fertility rates.
The Project Akar is on population. It is for stabilizing the population, which I think impacts practically every aspect of the planet and the sustainability of the planet. We are working in two districts in UP, namely Barabanki and Bharich, which have the very high fertility rates, TFR is known as, and we are creating awareness amongst the newly married people, among the young people who are going to get married, and making them aware about spacing their children as well as having 2 children and leave it at that.
Project Akar, as the name suggests, is about shaping the size of family. Objective is to strengthen population control initiatives in the state of Uttar Pradesh through education and empowerment.
The government of Uttar Pradesh recently announced a new population policy.
जनसंख्या नीति 2021 से 30 यह जारी हो रही है। इसको जारी करते हुए मुझे प्रसन्नता की अनुभूति हो रही है कि काफी तथ्यों के साथ समाज के विभिन्न तबकों को ध्यान में रख करके इस जनसंख्या नीति को लागू करने का कार्य आज प्रदेश सरकार कर रही है।
Project Akar aims to tackle the problem of overpopulation in India, keeping in line with the government's population stabilization goals. It also aims to bust myths and taboos that are detrimental to population control, and also to change mindsets of the young. This is achieved by combining counseling and community deliveries of contraceptives.
We are doing 3 kinds of interventions. Number 1 is provision of services such as counseling for the women and girl child, contraceptive distribution, and education and empowerment.
The work, carried out by on-ground volunteers, ASHA workers and coordinators, involves promotion of modern contraceptives among couples, educating youngsters on reproductive health, family planning and the merits of early marriage.
India is the second most populated country in the world. Our population is estimated to be around 135 crores, and the increasing population adversely affects every criterion of development. Statistics state that birth rate in India is 20.1 per thousand people. In the state of Uttar Pradesh, it is 25.6 per thousand people, while in the district of Barabanki, it is 26.4 per thousand people. The population growth rate in Barabanki needs special attention. Many departmental policies have been implemented to stabilize the birth rate, and a considerable decline has been registered during the past 3 years. However, considering the geographical composition of India, we require the assistance of associate institutions in reaching out to many remote villages.
हमें सहयोगी संस्थाओं की भी जरूरत पड़ती है।
मोबियस फाउंडेशन जो हमारे बाराबंकी में कार्य कर रहा है।
The counselors from Mobius Foundation travel to different villages and spread awareness on family planning by visiting every house in the village. With the help of on-ground coordinators, counselors from Mobius Foundation promote family planning methods among the local beneficiaries, advising them to embrace contraception after having 2 children. Such awareness is not only helping in stabilizing the population and controlling the birth rate, but also with enhanced access to resources, it is now possible for families to take care of the health of their children and educate them in a more desirable manner.
Project Akar's counselors travel to villages that are identified as having a high birth rate and low uptake of family planning services. Today we are going to the Setmu village in the district of Barabanki. It is a 30-minute drive from the capital, Lucknow, and has been identified by the Mobius Foundation as a priority village. The work carried out by Project Akar is chiefly done through mobile clinics, where counselors and supervisors set up temporary counseling sessions. These village clinics are making an impact by reaching young people before they start a family. They teach them about the importance of family planning and truly empower people at the grassroots level. Project Akar also makes an impact on school-going children living in rural areas. In this school in Barabanki, counselors are introducing youngsters to the concept of reproductive health and educating them about the drawbacks of early marriage.
We visit schools and impart knowledge about menstrual hygiene management. We advise girls to use good quality sanitary pads. Many of them refuse to attend school during their menstrual cycle. However, we advise them to not skip classes and practice menstrual hygiene.
All the students are engrossed in activities and lessons taught by Project Akar's counselor. In this classroom, the youngsters are being taught about the benefits of not marrying too early and the importance of education.
An educated woman can run her household well, and it is of utmost importance that women get educated, as they can have an independent identity and can excel in every aspect of personal, social and professional life.
Girls should not get married at a young age. If their parents force them to get married at an early age, they should reach out to their relatives for help. If the parents are still persistent, girls should reach out for help by dialing the Women Helpline number 1090. Girls should only get married once they complete their education.
Education is important for girls so that they can excel at their careers and support their parents.
These local students have been inspired. And it seems like this approach to the overpopulation problem is effective. There are also other forms of reaching out to people, such as this rural Nukkad Natak skit, or street play that also conveys an important message.
नमस्कार, आदाब, सत श्री अकाल दोस्तों। यहाँ लेकर के आए बहुत ही बेहतरीन नुक्कड़ नाटक जिसका नाम है दंपत्ति नंबर 1। वैसे भी हम इस पूरे गांव में 1 नंबर के दूल्हे हैं और हमारी दुल्हनिया भी एकदम लल्लन टाप। देख रहे हो आप लोग।
देखो भैया, अब तुम्हारा बैंड बाजा तो बच चुका है।
हाँ।
समझ रहे हो? और ऐसे दंपत्ति नंबर 1 नहीं बनते हैं। दंपत्ति नंबर 1 वो बनता है जो परिवार नियोजन को अपनाता है।
मोबियस के द्वारा हम लोग को
We are very well informed and trained by the camps organized by the Mobius Foundation. We assemble the beneficiaries at the camp and spread awareness about family planning methods. On our field visits, we educate them about contraceptive options such as pills and condoms. We have registered wonderful results. The couples we have counselled tend to space their pregnancies. We are working with the Mobius Foundation on this and we hope that this cooperation continues.
The Mobius Foundation organized camps and introduced us to family planning methods. I have 2 children and I was advised by counselors to undergo a non-scalpel vasectomy. I underwent the procedure and I have to say I faced no challenges at all. Many men falsely believe that having a vasectomy could make them impotent, but this is not true. I would like to encourage other men to consider male sterilization.
To find out more about how interventions are happening in the districts of Uttar Pradesh with the highest fertility rates, we visit Bahraich district. It is one of the 100 villages that the Mobius Foundation covers as a part of its outreach work.
Mobius Foundation has taken up 100 villages in this district and they have managed to counsel 28,000 couples about family planning.
We have been working with the Mobius Foundation constantly on promoting family planning practices in different blocks of Bahraich district. The outreach camps organized in different blocks have been helpful in spreading awareness on family planning. Many people from remote villages attend these camps for counseling on family planning, and the on-ground team of Mobius Foundation helps them with their concerns on how to plan their families.
Today we are visiting the maternity wing of the Kisarganj Hospital in Bahraich. Project Akar sets up mobile clinics in villages here. Women can receive counseling and advice on family planning solutions, and they have a safe place to share their doubts and concerns.
It is my responsibility to visit and organize camps at the public health centers, community health centers, and villages. I try to reach out to as many women as I can. We carry Maladi and condoms with us and we distribute these contraceptives to women as per their requirements. We register their details and also follow up with their progress.
These Asha and Anganwadi workers are going from house to house. They offer counseling and free birth control, such as condoms, pills, and copper IUD to the villagers. At this hospital in Barabanki, celebrations are on for the annual Family Planning Day, and the hospital's superintendent opens up the event. Many of the people working with Project Akar are here, including counselors, drivers, and coordinators, as well as people who have received help through this initiative.
The work being done by Mobius Foundation in our village is appreciated by everyone. They distribute medicines among the people to help them plan their families. Mobius Foundation even distributed rations during the COVID-19 lockdown period.
When it comes to family planning, it is important that both the husband and wife are on the same page. It cannot be successful if either one doesn't agree to the idea.
The campaign thought for Project Akar is raising a family is a responsibility. It is of utmost importance for every married couple to be aware of their reproductive health rights and have access to quality family planning services and methods. Projects like these play an important role for rural communities and reiterate the government's population policies. For any society to develop, women need to play a central role. Their voices and participation is crucial in order to overcome patriarchal mindsets. and the road to development requires both men and women to get an education. The positive relationship between education and women's empowerment can reduce child labor, child marriage, and illiteracy, female feticides, and other evil norms. Without education, women will have fewer opportunities for making a change. Poverty, unemployment, and inequality are problems that require women's participation in an active and equal way.
What I would like to see is for women and girls to have choices of when, if, and the spacing of their children. And that can only happen if they have minimum education, information about family planning, about modern contraception, and if they have access to services, not too far from their homes. Hopefully, the women will make the right choices.
When it comes to women's empowerment, the men's participation in the training is also important, as they also need to be aware of decisions that their family will take. Be on board with choosing to use birth control, to have children later in life, and opting to have a smaller family. Having men participate in the learning can change their mindset and strengthen the family bond. In rural India, promoting gender equality and women's economic empowerment go hand in hand.
Empowering women is very important for family planning and, of course, population stabilization. Once they are empowered, they take their own decisions about the family size, about their body, about the health, as well as quality of life.
Educated women generally have fewer children than the ones who don't have access to an education, and are also able to provide better care for their children, thus increasing the value of their children's human capital and reducing the need for more children. Educated mothers also use their knowledge to improve the health of their family, and knowledge about health risks can also protect them against illness and can reduce child mortality.
They are equal contributors in the economy. They should be part of the workforce, and that will definitely make the families realize that early marriages are detrimental for the families and for women. And if they're educated, if they have good health care, if they have good nutrition, they will be part of the inclusive growth of the country.
Education is one of the most powerful tools we have to stem population growth. The effects of education on overpopulation cannot be overstated. Currently, nearly 45% of pregnancies worldwide are unintended, leading to millions of births per year.
If you're less educated, the likelihood that you can access even that you can know that there is such a thing as a modern contraception method is lower.
When looking at countries where the population growth rates have slowed down, you notice that all of them have high levels of education without enforcement through child policies.
There is a negative relationship between increase in education and the fertility rate. That is what I'm saying. The higher the education level, the likelier it is that women will have fewer children.
In fact, education is a major indicator of lower fertility rates. In India too, better education, particularly of women, have reduced the total fertility rate in various states. And when general education is combined with interventions like family planning outreach, counseling sessions and contraceptives distribution, the total fertility rate can drop substantially.
Prioritize those people, those couples who want to adopt family planning and make sure that they get a choice. Let's not make up their minds for them. Let them make up their mind, but we need to give them quality services and good counseling to ensure that they adopt family planning.
People living below the poverty line are often unable to afford or access education for their children. Yet, education is a crucial tool that can help developing countries out of poverty. This can lead to an unsustainable cycle where families below the poverty line cannot reach prosperity for generations. Education is a fundamental right of every child in India, and central and state governments must ensure that no one is left behind. Girls have to be given an equal chance if we are to rid our societies of poverty and overpopulation. Better educated women are also likely to participate in the formal labor market and earn higher incomes. This can help lift their households and communities out of poverty.
India is almost like a region. If it were in another country, I would be comparing India with other countries to say, look at Thailand, look at Singapore, or look at France. But I can stay in India because I have two demographic, realities. One where you are below replacement level and one above in the country itself. So when I compare those two states or others that are still above replacement level, the main feature is actually education and income. And what is the education level of the couple, but mostly, most important, education level of the woman.
We have now seen a number of issues with overpopulation and how they can be dealt with in order to stabilize the population growth in rapidly growing regions. Ground interventions in hard-to-reach rural communities play a crucial role in the overall development of the country.